Hello everyone, I'm Lakshmi from Department of Exercise Physiology and Nutrition. In this video, I'm going to talk about exercise for special population. Briefly, I'm going to explain how to deal with clients who are having chronic health conditions and physical or functional limitations. So what is physical or functional limitations? Let me give you an example of doing handstand. A normal healthy individual will be able to do handstand easily. So is it possible for a pregnant lady to do handstand? No. So there are physical and functional limitations for certain group of people. So how you're going to deal with such group of people? Let me give you another example. So there are generalized guidelines are there for designing cardiovascular training and resistance training. So these generalized guidelines will not apply for everyone. ACSM recommends that you should do at least 120 minutes of aerobic activity in a week time. So is it possible for everyone to do at least 15 to 20 minutes of aerobic activity every day? No. So there are certain group of people where they will not be able to do even 5 to 10 minutes of aerobic activity. So for those kind of people, what you're going to do? So those group of people will come under special population. Now let's see who all will come under special population. So first one is women. Women will come under special population. So why women? Because generally if you compare men and women, they differ anatomically and physiologically, and there are physiological differences are there between men and women. One example is muscle mass. So if you compare muscle mass between men and women, it differs. Normally men they have more muscle mass to compare women, and if you take body fat percentage, normally women have a higher amount of body percentage to compare men. So there are physiological differences. So when you are designing exercise program for women, you have to consider these physiological differences, and you need to consider their exercise response also. And the second category is pregnant ladies, and pregnant ladies also will come under special population. And when you are designing exercise program for pregnant ladies, actually you should start with doctors advice. Always you need to work in line with doctors and physiotherapist, especially when you are dealing with the pregnant ladies. Okay. Normally healthy women who's doing exercise already can continue doing exercise during pregnancy, if there is no contraindication of doing any physical activity. And um, the second category is children and adolescents. So even these people will come under special population. And the third category is older adults, and fourth one is people with chronic health conditions, people with diabetes, obesity, and cardiac problem. So those kind of people will come under special population. So for them, as I have mentioned in my previous slides, generalized guidelines will not apply for these group of people. So as an exercise physiologist, as a personal trainer, are you going to invent new exercise and include that in your exercise program? No. So here fit principle applies here also. Generally when you are dealing with a special population, you can actually reduce the intensity, and you can reduce the duration of the activity, or maybe you can change the position and make your client to do exercise. So these kind of general principles will apply when you are dealing with a special population. And okay, this all generalized guidelines. Now let's go to the next slide. Women and exercise. Let's see how women responds to exercise. So normally women have lower absolute and relative maximal volume of oxygen consumed per unit of VO2 max values. So if you compare men and women, the VO2 max values, normally women will have lower volume of oxygen consumed per unit of VO2 max values. Okay, and men, they have more muscle mass and they have increased hemoglobin levels. And women, on the other side, if you take women normally have lesser amount of muscle mass and hemoglobin level also is less. So hemoglobin, normally you all know what is the function of hemoglobin. So it is it carries oxygen to all the working muscles, right? So if you have increased amount of hemoglobin level, and automatically your oxygen consumption also will be higher. And so what happens consequently, it lowers stroke volume, and which leads to increased heart rate to maintain cardiac output. So this is all the physiological difference of women. So this is major point here in this slide is amount of muscle mass and hemoglobin level. So due to these, the muscle mass is less and hemoglobin level is less. So women, when they do exercise, their stroke volume is lower, and that leads to increased heart rate. So these are the generalized physiological differences, okay, when women do exercise. Now let's go to the next slide. Women physiological differences. Women have increased level of body fat, which is necessary to maintain a healthy menstrual cycle and support pregnancy. I have mentioned this already in my previous slide. Normally women have more body fat. It is mainly for maintaining healthy menstrual cycle and support pregnancy. And due to this, women have a lowered amount of lean body mass to compare with men. So when you are having a lower lean body mass, it leads to lesser amount of consumption of oxygen, and this leads to decreased overall strength in women when comparing with men. So this is the reason for for women being weaker than men physiologically. Okay, so let's go to the next slide. Exercise testing and prescription. So we were discussing about how to design exercise program, and now exercise testing and prescription. So is it same for both men and women? If you ask me, yes, it is same. So if you want to test core stability or core strength of women, you can administer same test for both men and women, and exercise prescription also is same for both men and women. Let's go to the next slide. Pregnancy. Okay, so now pregnant ladies, what are the physiological changes happens during pregnancy? Now let's see one by one. First point is anatomical and physiological changes. So normally they undergo a lot of anatomical and physiological changes. So this is mainly caused by the hormone called gestational hormones. So this particular hormone secretes only during pregnancy, from the consumption and till the delivery. So this period fully, this gestational hormones this secretes, and this hormone is actually is very good for pregnant ladies, because it helps for both mother and baby in the womb. And healthy women normally are encouraged to exercise throughout pregnancy without contraindication. So what are the benefits of doing exercise during pregnancy? So normally during pregnancy, they gain more weight. So that you can prevent by doing regular exercise during pregnancy. You can actually reduce the risk of gaining excessive weight. And the second benefit is decreased risk of development of contraindication associated with pregnancy, such as gestational diabetes and pregnancy induced hypertension, which means normally pregnant ladies, they have pregnancy induced hypertension and diabetes. So these conditions you can actually decrease by doing regular physical activity during pregnancy. Okay, so let's go to the next slide. Exercise response. Okay, how a pregnant lady responds for exercise. So there are metabolic response and cardiovascular response and a respiratory system response to exercise. Normally it has effects on various systems of your body. And in metabolic response, if you see, oxygen uptake during weight dependent exercise is increased and oxygen uptake during weight dependent exercise is unchanged, which means during weight dependent exercise means resistance training. When pregnant women when they do resistance training, oxygen uptake is increased. And cardiovascular response, during exercise your heart rate is increased and your blood volume increases by 50%, and then it increases the stroke volume and cardiac output, and but there is no change in systolic and diastolic blood pressure. It remains unchanged when a woman do exercise. Let's go to the next slide. Okay, so ventilatory response, if you see, minute ventilation increases and tidal volume and breathing frequency increases. And fetal response, so how a baby which is inside the womb get benefited by doing regular exercise by a pregnant lady. It increases the blood flow and oxygen delivery to the fetus, and heat dissipation happens and glucose availability increases, and nutrition delivery to the uterus, it increases. And women who exercise tend to divert more blood flow to the skin and begin to sweat sooner, allowing heat to dissipate more quickly without causing a dangerous increase in fetal temperature. So it reduces the fetal temperature if pregnant women if they do exercise. And fetal birth weight, it controls birth weight of baby. Okay, and mode of delivery, women who exercise during pregnancy are less likely to give birth to overweight or low birth weight babies, and they'll be at lower risk for cesarean delivery if pregnant women, they do exercise during pregnancy. Okay, let's go to the next slide. Okay, so next comes the last category, people with health conditions or deceased people. Okay, people with these kind of diseases. Let's see one by one. Coronary heart disease, hypertension, obesity, diabetes, asthma, bronchitis, arthritis, fibromyalgia, osteoporosis, low back pain, multiple sclerosis. So if a person is having these kind of conditions, these people will come under special population. And here I'm going to talk about only obese people. Okay, so how to design exercise program for obese people. So before we discuss about exercise designing, let me present some facts. According to ICMR, the prevalence rate of obesity is 11.8% to 31.3%. Okay, so which means 30% of our population is obese. So this number is actually, it's keep on increasing in the past decade. If you see, if you just go and read research articles, this number is actually, it is increasing. So there is a common method to calculate overweight or obesity is BMI, right? Everyone knows about BMI, and this is the most prevalent health disorder in India. Let's go to the next slide. Okay, so generally when you are training obese people, you have to actually make the activity as enjoyable as possible, and it should be pain free, because normally obese people will be having knee pain and back pain and these kind of general problems they will have due to their overweight and more body mass. So you have to actually make it enjoyable. Whatever activity you include in your exercise program, they should have positive feeling about doing exercise. And identify the right combination of activities. The combination, you can't, their major goal is reducing weight. For obese people, reducing weight is the major goal. So for them, you can't ask them to run on the treadmill every day for half an hour because they want to reduce weight. So it is actually a bad idea, because they will drop out. And exercise adherence is very very important. Motivation is important, when especially when you are dealing with clients who are obese. And the third point is, keep the activity at an intensity level that does not cause pain or soreness. So what happens if they feel, if they have negative feeling about doing exercise, if they have pain, and they will not come to you next day. Okay, so your intensity level also should be low, and you can actually do it for a longer duration period. And emphasize low intensity and high duration activities. Ensure that they have positive feeling about being physically active. Weight maintenance is a lifelong process, so daily dose of physical activity is needed. So if they miss classes, if they are not regular, and they can't achieve the goal of reducing weight, so they have to be regular, because weight reduction is not an easy process. And normally obese people will be having arthritis problem, and you have to consider that also when you are designing and handling a client who's obese. And you can actually include water based activity. It is one of the best forms of activity you can recommend for obese people. It is very safe, and if you have the facility of doing water based activity, you can have that in the in your priority list on the top. And the last point is, resistance training can be included at least 2 to 3 days a week, at least 10 to 15 minutes a day. It is not only for obese people, generally for everyone. You have to include at least 3 or 4 sessions of resistance training in your exercise program, and it applies for everyone. Okay. And exercise testing. Okay, exercise testing and prescription, as I have mentioned already, it depends on the individual's physical fitness level. And firstly, you need to check whether it's necessary or not. And the prescription also, it differs from person to person. So that's it for today. Thank you guys, thank you.